but not a lot of people understand, like, there are things, going on inside your body that, can be corrected.
My uncle got esophageal cancer, and talking with the doctor who he had a really good relationship with at that point, the doctor pretty much told him, had he been proactive in the acid reflux and taking care of the GERD, more than likely it wouldn't have been progressed to that amount.
It was just it was eye-opening, I guess. Hard to say, it's the realization is once someone does pass away from it close, it's you understand, especially when you have all the pains and signs, you just wonder, is it something that's coming for be next for you?
No matter what I would take, it would just still have all that burning in there.
Actually didn't really think that there was anything that could be done. I thought it was just something that I had to deal with.
As soon as I lay down, I'd end up waking up at night and just aspirating, and I aspirated so much that I was starting to lose my voice.
I sought some help and was diagnosed with GERD. Before that, it was just a thing I dealt with, but then it became something that actually had a name.
Hello, everyone, and welcome to our TIF Talk today. My name is Andrea Millers. I'm the Senior Director of Marketing here at Endogastric Solutions. I'm joined today with my market development team, Wendy Profit from Cincinnati and Lynn McFadden from Phoenix, Arizona. Thanks, guys, for being here tonight. We really appreciate it. We don't have a special guest tonight as far as a physician because we are doing a special TIF talk for esophageal cancer awareness. Some of you may or may not know about the correlation of GERD and the potential risk for esophageal cancer. Before we start, though, I see some people jumping on. Hi, Jane. Hi, Melissa. If you are joining us tonight, please type in the comment section where you're joining from or tuning in. We do have these Fight GERD hats today that we will be giving away to some people. So please type in where you're commenting from and tuning in from, and we will let everybody know who wins the hat. So according to the Salgi Esophageal Cancer Research Foundation, 10 to 15% of GERD patients will develop Barrett's esophagus, which is a precursor to esophageal adenocarcinoma, EAC, otherwise known as. In the past 3 decades, EAC has increased over 600%, meaning it's one of the fastest growing cancers in the US and other Western countries. Why is that important to us? Because it's preventable. According to the American College of Gastroenterology, 1 in 5 US adults suffer from GERD. That's an estimated 60 million Americans. Approximately 20 million patients take PPIs for the reflux, and unfortunately 40% still have symptoms. PPIs help manage GERD symptoms by suppressing acid production, but they do not fix the root cause. Oftentimes, managing symptoms requires increasing the dose of PPIs and the duration of use beyond what is FDA approved. Additionally, studies of long-term PPI usage have shown possible side effects, including increased risk of bone fractures, pneumonia, C. diff, vitamin B12 deficiency, chronic kidney disease, and dementia. So our goal here at Endogastric Solutions is to educate our viewers and those that are suffering from GERD the importance of having GERD diagnosed and treated by a medical expert. We also want to raise awareness that the TIF procedure for reflux is an excellent option for patients who no longer want to depend on daily medications, PPIs or whatnot, and or want to treat the root cause of their reflux disease. Tonight, we have a very special program. We will be talking a little bit more about esophageal cancer. We'll hear some astonishing facts and statistics about esophageal cancer. We'll also share our efforts to raise awareness with our annual Walk for Walt event. We'll view a very special GERD patient story that was actually broadcast on the national TV show The Balancing Act on Lifetime TV. And then lastly, we'll hear some recommendations from GERD specialists and physicians regarding GERD and esophageal cancer. So I'm going to pass it over to Wendy. She's going to go over a couple of things.
Thanks, Andrea. Well, tonight we'd like to spotlight some helpful information surrounding the subject of esophageal cancer, its prevalence, and its impact. Until recently, this has been one of those conditions that has been considered a silent thief of life. And we are drawing awareness through the help of many organizations to the greater public, and are very pleased to share some helpful information tonight. We'd like to thank Mindy Mordecai and her team at the Esophageal Cancer Action Network for allowing us to share the following video with you. For more information on this important organization, please visit www.ecan.org. That's www.ecan.org. There you can download a free patient guide with information on GERD, on Barrett's esophagus, and on esophageal cancer. Take a look.
So we love that there's 1 month out of the year that's dedicated to raising awareness about esophageal cancer and the tie-in that reflux has. As a company, Endogastric Solutions spends every day raising the same kind of awareness and spreading that same messaging to both healthcare professionals and consumers alike. And April is especially important to us because it hits close to home as we lost a dear friend and colleague, Walt Bride, to esophageal cancer not too long ago. Every year in April, we rally as a company to do our annual Walk for Walt memory and in a continued effort to raise awareness about esophageal cancer and eradicating this disease. Please take a minute to watch our special walk that just occurred last month in Dallas as we remember our colleague, Walt Bride. Take a look.
What's going on, Andrea?
What are we doing today?
It is the Walk for Walt.
April is Esophageal Cancer Awareness Month, and so we're doing this to raise awareness on behalf of former colleague Walt.
Today we are, as a company, raising awareness for Esophageal Cancer Awareness Month, specifically for one of our colleagues, Walt Bride, who unfortunately had passed away. So we want to raise awareness for Walt and the rest of the world that suffers from this disease.
What does GERD have to do with esophageal cancer?
Well, it's a precursor to patients that end up coming down with esophageal cancer. So it's something that we can treat early in a person's life, and so it's a great cause to be putting some energy and effort towards. Education out there so people know what's going on and people don't have to suffer from esophageal cancer.
It's probably one of the worst cancers out there, so that's why it's so important to make sure people understand what GERD really means.
If you knew Walt, he was an incredible person. I mean, a great teammate. He would give you the shirt off his back, and he would help you in any way possible. And then again, the Walk for Walt and esophageal cancer, it's important to us because most people still think of GERD as a lifestyle disease. They don't realize the downstream impact of that. I know all you guys do, but again, I wanted to thank you for this. We'll get more education out there to be able to kind of help eradicate this disease.
Hey team, I'm just walking in my neighborhood, doing my virtual 5K in honor of Walt Bride and in support of Esophageal Cancer Awareness Month. You know, men are 3 to 4 times more likely than women to develop esophageal cancer. And those of us between 45 and 70 have a higher risk. Now, I didn't know Walt personally, but sounded like a really wonderful, compassionate human being. And through Walt's memory, and of course, with spring upon us, it's a great season. It's a time of rebirth. It's a good time for us to think about our own health. So if you or someone you care about is suffering from GERD, encourage them to see a doctor, to get checked out. There's lots of great treatment options that are available, especially if you can get the disease early. And so make sure you take care of your health this year especially. Do it for the ones you love. Do it for Walt. Have a great day.
Hi, I'm out walking for Walt to raise awareness of esophageal cancer and to encourage people to fight GERD.
We are employees of Endogastric Solutions, and we are walking here in the park today because April is Esophageal Cancer Awareness Month, and also in memory of a great coworker and friend, Walt Bride, who succumbed to esophageal cancer.
Heartburn can be a symptom of something called gastroesophageal reflux disease, also known as GERD. It is a potentially serious condition that, left untreated, can ultimately lead to esophageal cancer.
Men are 3 to 4 times more likely than women to develop esophageal cancer.
If you, a friend, or family member suffer from heartburn, please check the website gerdhelp.com and help us continue to
Fight GERD.
What are we doing here today?
We are walking for Walt Bride.
And who is Walt Bride?
Walt was a colleague of mine down in Florida. He was a great guy, a great individual, and sorely missed. Walt unfortunately passed away from esophageal cancer. I don't really even think he had very many GERD symptoms. I don't even think he was on a PPI, but it's an insidious disease, and by the time it was caught, it was too late. He had an esophagectomy, so they took out the cancerous portion of his esophagus. After that, he had a Nissen fundoplication, which was done in his chest. He had a lot of difficulties eating and keeping things down, and sometimes overcoming his Nissen fundoplication. Unfortunately, his cancer returned, and after about a year after that, we lost him.
Why are we out here raising awareness for esophageal cancer?
Well, esophageal cancer is one of the fastest growing cancers in America, and so I think it's important for us to help raise awareness of esophageal cancer. I do want to also mention that when Walt was near his final days, probably about 3 weeks before he passed, I had been putting off my TIF for a couple of years, and
he's looking at me.
One of the last things Walt ever told to me was, take care of your health, quit putting it off. And he said, trust me, Alan. And that was really powerful. And it was at that point that I seriously started the process to get my TIF done, and I'm so glad I did.
When did you get your TIF procedure?
In September of 2019.
And how are you feeling today?
I am reflux free and I'm off of PPIs. It's like a wet blanket has been lifted.
Wow, I can't wait to get mine.
I know.
Tell me a little bit about Walt.
I met Walt once. It was a couple years ago. We were at Nashville in our meeting, and as we were leaving, the best advice he gave me, he's like, don't sweat the big stuff. He's like, enjoy your family, enjoy your kids, enjoy every minute of life because it's so important.
Love that, Keith. What does GERD have to do with esophageal cancer?
Well, the biggest thing is you've got over 19 million people a day that suffer. So we have to make people aware to make sure that they're not just self-medicating, that they go see their doctors, talk about their problems, get checked out to make sure that they get taken care of so that they can avoid that. Because I've been taught by physicians over the years that if you get esophageal cancer, even if they can fix it some way, esophagectomies, things like that, eventually it comes back. It's probably one of the worst cancers out there. So that's why it's so important to make sure people understand what GERD really means.
So super proud of our company and all of our employees that are out in the field, and also those that were from Redmond, our home office, that participated in our Walk for Walt. Super special, very, very special. So next up, we do want to show a really great patient story. And it was actually on national TV on the Balancing Act on Lifetime. It was a great story about a patient. Her name is Tori, who was suffering from GERD, and Dr. Chang, who did her procedure. So stay tuned and watch this.
1 in 5 adults, or nearly an estimated 60 million Americans, suffer from acid reflux or GERD.
That's astounding. This can dramatically affect quality of life. So many people resort to proton pump inhibitors, or PPIs, to treat symptoms. But medical therapy doesn't treat the root cause. Now, even while on medications, Montel, GERD could lead to, unfortunately, esophageal cancer.
Well, today we're on location in Orange County, California, to learn more about a minimally invasive procedure for acid reflux called TIF. Take a look.
The first symptoms of heartburn I can remember was age 5, and I can remember my mom giving me some ketchup, and I told her, ketchup gives me heartburn, and she's like, you're 5 years old, you should not have heartburn from ketchup. The symptoms of reflux that I had were bloating in my stomach, the acid taste in my mouth, the acid flowing up through my throat, the sore throat, scratchy voice, all the typical symptoms of GERD.
In her 20s, Tori had her first endoscopy and was diagnosed with hiatal hernia. Her doctor said this could be causing GERD, and she could continue taking PPIs to treat her symptoms.
When I started taking the PPIs, I noticed that I started to gain weight. I was having a lot more bloating in my stomach area, and just an overall feeling of unhealthiness.
The Balancing Act met with Dr. Kenneth Chang, a specialist in interventional gastroenterology and esophageal diseases.
The workup of a GERD patient starts with an upper endoscopy where we put a scope down and we're looking at the inside lining of the esophagus and stomach. We're looking to see if the inside valve is loose or the outside valve is loose. We're also looking for complications of acid reflux, such as precancerous Barrett's, strictures, ulcerations, and that's why we do a comprehensive workup and we individualize the treatment options for the patient.
By the time she was 40, the PPI stopped working. Tori was desperate for a solution.
When I had my first consultation with Dr. Chang, he was very excited because he thought I would be a great candidate for the TIF procedure. And what was so appealing about it was how minimally invasive it was and what an easy recovery it would be, and with basically no side effects.
Tori received a TIF procedure, which is a combination of a laparoscopic hernia repair plus the TIF.
The TIF procedure corrects the root cause of GERD, which is an anatomic defect at the gastroesophageal valve. It rebuilds the lower esophageal valve and restores the body's natural protection against reflux. The TIF procedure is performed endoscopically and allows the physician to repair or recreate the body's natural barrier to reflux.
The TIF procedure is revolutionary because it really fills a large treatment gap by offering a less invasive endoscopic procedure and gets to the root of the problem. According to randomized controlled trials, over 80% of patients after a TIF procedure can completely come off their PPIs with great symptomatic control.
A patient's condition will determine how frequently they will need a follow-up endoscopy. Some patients need follow-ups every 3 to 5 years, while others do not require any at all.
Every time I have my follow-ups with Dr. Chang, I'm always telling him how this was such a life-changing procedure for me. The TIF was everything that they promised it would be and more. I have not had reflux, and I can't even remember what it's like to have reflux. Now that I've had the TIF procedure, margaritas and red wine are always on the agenda, and it's great to be able to do yoga, Pilates, do exercises that involve stretching and getting back to my dance roots, where I couldn't do that for so long. And it just feels great to be back doing things that I enjoy.
If you're suffering from GERD and want to learn more about the TIF procedure for reflux, visit GERDhealth.com.
And of course, you can always go to our website, thebalancingact.com. We'll be back right after this.
We are so glad that Tori was able to find the reflux relief that she needed with the TIF procedure. And now, let's hear from the medical experts on the relationship between reflux, Barrett's esophagus, and esophageal cancer. Have a look.
GERD is a problem, a chronic problem. Once you develop reflux, it does not go away with medication. If you have a loose valve, it persists, and with age, unfortunately, it tends to become more loose. So the option is to go in and tighten the valve. So Barrett's esophagus, and I treat a lot of Barrett's. I had a big NIH grant when I was in Seattle. I was part of the Seattle Barrett's Esophagus Center, which is a world famous center. If you treat Barrett's, the purpose is to try and prevent progression of Barrett's or abnormal epithelium to cancer. Barrett's goes away. But if the reflux persists, if you don't treat reflux, what we found is that within a year to 2 years, Barrett's come back. So it's a two-step procedure. First, you need to go and treat Barrett's esophagus, and then you need to treat acid reflux problem, anatomically fix the valve so Barrett's does not come back.
It's very interesting you bring it up. I think we are having this conversation at an important juncture where we have to make people more aware of the situation. If you look at a number of diseases that we deal as in healthcare, for instance, let's take knee pain. And if the pain gets worse, you assume that your arthritis is worse. So the severity of symptoms is linearly correlating to the severity of disease. In acid reflux disease, that's not the case. You can have patients who feel that their chest is on fire and they're going to die with chest pain, and we do an endoscopy and we can find a completely normal looking esophagus. Whereas you may have patients with very minimal symptoms and you go in and you can actually see really bad disease. So the severity of disease does not correlate with the severity of symptoms with regards to acid reflux disease. So we have been educating our patients, our primary care doctors, and our colleagues, our ENT colleagues, our pulmonary colleagues who manage a lot of our GERD patients, that, you know, just because they have minimal symptoms doesn't mean they have minimal disease. So this is something that they should not ignore. You know, GERD is like we talked about, it's a very common disease. It's the most common disease that a gastroenterologist would encounter and will continue to encounter in the office visits and in the outpatient setting. It continues to be on the rise. We know GERD or reflux disease is the most important risk factor for esophageal cancer. You have other complications before esophageal cancer, such as Barrett's esophagus, which helps us at least detect and prevent complications of GERD.
It's easy for all of us to forget this, that having reflux is common. So it's part of being a human being and part of eating and digestion, but it's not right to have reflux on a regular basis and requiring medications on a regular basis. That is a medical condition. Any pharmacy, any grocery store, any gas station, in fact, will have, you know, antacid medicine. So it's kind of made it seem like it's normal. It's not normal, and I think it's important for the audience to, you know, hear that and make that an important part of the awareness, is that taking antacid medications is considered a pharmaceutical treatment of a disease. And if you're taking a prescription medication but still having to take additional antacid medications over the counter, that means you're not adequately responding. And it has nothing to do with the medicine not working for you. It has everything to do with the fact that there's a mechanical problem. It's an anatomic problem that needs to be fixed. We know from years and years of data regarding untreated heartburn. So this was laid out very nicely by a large study done in Scandinavia, I want to say about 20 years ago now, where they were the first to show the link between reflux and esophageal cancer, and this sort of became popularized as, you know, GERD can kill, because untreated GERD, unmanaged GERD, inappropriately managed GERD, undermanaged GERD can lead to changes in the lining of the esophagus.
The incidence of esophageal cancer has been going up for the last several decades, and it's really tied to an increase in reflux. And that reflux is probably tied to our diets and our weight and the acid blocking medications that we've been taking all that time haven't really dropped the incidence of esophageal cancer. So not everyone who has reflux gets esophageal cancer. So I don't want to make people nervous about that. That's a very low incidence, but esophageal cancer growth is tied to gastroesophageal reflux disease.
We are so very grateful to have all of the physicians that have been participating with us and doing these TIF talks with us every Tuesdays or sometimes Thursdays to help educate everyone out there that might be suffering from GERD. So first and foremost, Endogastric Solutions says a big thank you to all of our physician partners. In addition to that, we'd like to thank everyone that has joined us tonight and that joins us every Tuesday night to watch our TIF talks and talk about GERD, the potentials of esophageal cancer, and obviously the TIF procedure. Again, we do have these hats that we will be giving out to those people that told us where they're tuning in from. So look for a direct message from one of us here. We'll reach out to you and get that hat over to you. Again, we want to thank everybody for joining us. We will be back live next Tuesday with a physician guest speaker. But until then, Wendy, do you have any parting thoughts that you'd like to share with everybody watching?
Well, certainly. Thanks, everybody, for tuning in. Hopefully tonight has benefited you in some way, whether or not it's for yourself or information that you can share with a loved one. Maybe that extra nudge they need to get in and see an expert to have their needs addressed. If you are looking for a GERD expert in your area, please visit our physician locator at www.gerdhelp.com. There you can enter your zip code and see a list of doctors in the area who specialize in GERD and the TIF procedure for reflux. Lynn, would you like to tell them about the app?
Absolutely. Thank you, Wendy. We created an amazing mobile app. It's called GERD Help. You can find it and download it through your app store on either iOS or Android. It's highly educational, loaded with a lot of great content, videos. You can even input your vitals each day and really use it as your GERD journal. So we hope you download that and share that with your friends and family too.
Well, thanks everybody again for joining us tonight. We'll catch you next Tuesday for our TIF talk. Until then, stay safe and have a great evening. Thank you.